Welcome to Tuesday Talks. I'm Seema Kumar. I'm the CEO of Cure. Today, we will discuss a proposed government healthcare program called HEROES that aims to get serious about using predictive health and medicine to prevent diseases. The aim is to track better public health efforts to incorporate the latest discoveries in technologies into better predicting and preventing disease, and to offer rewards to those localities that use these new tools and see improvements in health outcomes. The man helping lead this proposed program is Dr. Darshak Sanghavi. He's a nationally recognized physician leader, pediatric cardiologist, TEDx speaker, and author. And recently, he was a chief medical officer of Babylon Health. He also has been the chief medical officer of United Healthcare. Today, Dr. Sanghavi is one of the first MD program managers at ARPA-H, which is a newly created multi-billion-dollar agency in the federal government that President Joe Biden has tasked with developing and creating bold new healthcare programs that accelerate better health in the United States. Welcome, Darshak. It's nice to have you here with us.
Great to be here. Thanks for talking to me.
Yes, and welcome to Cure.
Thanks. What a wonderful space.
Great. I'm so glad you're enjoying it. Well, first of all, congratulations on your new role. And tell us a little bit about your role and what is ARPA-H's intent in proposing this new program focused on health outcomes and preventing technologies that prevent diseases.
Yeah. So broadly speaking, one of the things we're so proud of here in the United States is our incredible investment in research and development in all kinds of areas related to healthcare. And yet what we find is that those results don't always sort of get to everybody who needs them. And so part of the thinking here with this program was how can we actually ensure that the promise of those technological breakthroughs, those incredible advances actually reach the people who really need them. And we're thinking, well, how can we solve for that? That's the promise that brought me to ARPA-H, which, as you mentioned, it's a new federal agency, and it's exciting to be there at the birth of a new agency. It's a little bit of a startup within the federal government. We were in a WeWork for the only federal agency to be in a WeWork for a while.
That's great.
So what our process is to supplement some of the existing, funding, like National Institutes of Health do incredible research, CDC, the Centers for Medicare do their own work. But the idea was, could we do things in a slightly different way, perhaps a little more accelerated, maybe take a few more risks? And it's to that end that I came in to try to see, could we use our resources of ARPA-H and the talent to actually solve for that problem, which is taking all those incredible things, but making sure they actually get where they should go.
And result in outcomes, right?
Yes.
Because at the end of the day, what good is discovery and breakthrough if at the local level, communities as a whole are not seeing improving health, correct?
Absolutely. And one thing we've known is that we tend to really place a lot of faith in our clinicians, our physicians, nurses, social workers, because they're really trying to do the right thing. And yet what we also know is the incentives that exist around that whole system sometimes guide that behavior, change it, and could be better. In short, you get what you pay for. So what we've thought about here is, in this particular program, is could we actually change the incentives in a fundamental way to create almost like a new market where we actually created the right incentives for public health and improvements in health at that kind of scale.
So these are novel interventions, right, that can sort of rapidly improve health outcomes, because sometimes these things take a very long time.
Yes.
The goal is to accelerate this, right, in specific geographic areas. So how is this shaping up, and what is going to be different about what's provided in the healthcare landscape today in the United States?
Yeah. So let's start with sort of take a problem many of us have been hearing about, which is maternal health. And we in the United States, we are not where we should be in comparison to our other nations that are similar to the US in terms of
the embarrassing, to be honest with you. The stats, for a technologically advanced nation, to have worse outcomes than the global South, I mean, that's a little frightening.
Yeah, and they're very inequitable also. Like, if you're one of the lucky few who happens to be in the right place, in the right setting, your outcomes may be fantastic, but then what about everybody else? So you say, why is that? So traditionally it said, well, think about all the things that have to go right. You have to have the right kind of insurance, and then that insurance has to work with the right hospital or the right doctors. And so what we've done, what we're thinking about doing actually with the HEROES program is two things. The first is to say, well, how about somebody owns the outcomes for an entire geography? That is not how we do things now. Now it's like, oh, these people who happen to come to my hospital, these pregnant individuals who happen to be in my insurance plan, we're going to create a geographic pool. So that's one of the first things. The second is that before you always got paid for, like, oh, if you do this procedure, you get paid. And so it sort of, there wasn't the right incentive structure. So for this particular outcome, we'll say, let's measure the rates of serious obstetrical complications in that whole area, and then actually create a prepayment, essentially a business case, a model, an incentive to lower that for the whole population. And those two pieces together, along with better data, when we put those three things together, we think that's going to revolutionize the care of pregnant women.
That's excellent. I mean,
Yeah.
but also it's not the care, right?
Yeah.
Because what I'm hearing you also say is that these interventional technologies that you're focused on are also focused on prevention,
Yes.
right? That's like the ultimate prize.
Yes.
So what kind of interventional technologies are we talking about? And give us a real life example. What could this look like?
Sure. So with these technologies, the thing is that it's often really dependent on what the person's particular medical needs might be. For example, pre-diabetes, maybe they have preeclampsia, maybe their issue is they don't have transportation to get, the technology, we think about it really widely. So let me give one example of the problem. We know that individuals, women on Medicaid, let's say after they have their baby, they go home. The majority of women never come back for a postpartum visit. It's incredible, And in fact, when you look at maternal morbidity or mortality even, a large amount of it actually occurs after they leave the hospital. In other words, they've seen the doctor. We know who they are, and yet we're not acting on it. So technology right there, let me give two examples. The first is, imagine if the moment you left the hospital, you then actually had the technology that would remind you, oh, did you get screened? Did you get your blood pressure checked? Are you doing it at home? There's a number of digital technologies. There's a number of sort of AI-enabled approaches that could help during that process. The second is, suppose a need is identified. Somebody is coping with postpartum sort of depression or significant challenges, then what about all the technologies that can be brought to bear on those individuals? And that might be very different if you're in a rural area versus in an urban area, or if you have a language difference. So those are the kinds of technologies we are going to really sort of accelerate.
That's great. So what is what's the timing for this? I mean, and have you gotten started already? And what does HEROES mean? Does it stand for something?
So one of the pleasures of being at ARPA-H is that
you guys love acronyms.
So you know what I'm talking about. So our
I do
first
know what
program that was announced last year was called Nitro.
Yeah.
And then we've got PSI and React
Patio.
and things like that. Yeah, Patio.
Yeah.
So the funny thing is that our acronym right here, we just want people to remember the HEROES part.
Yes.
Because they're, to some extent, that's what we're looking for, is the heroes in the community that they can do that kind of work. Yeah. But what we're looking at, we're very excited about this proposed program, and we're hoping that in Q1 or very soon we'll do a full public announcement where we'll talk about all the details. Because you can imagine there's a lot to know. Like whenever you think about how do you create incentives, invest in technology, sort of big, sort of geographic areas. But I do feel confident that it's going to be very exciting.
That's excellent. And, so you're saying, that these are technologies that are certain types of technologies that are going to, play a critical role in prevention, actually, right? And that too at the community level.
Yes.
So that you can see outcomes. So how does this technology scale to everybody across the United States?
Yeah. So I'll say one of the things I think I want to emphasize is that we at ARPA-H are not telling people this is exactly what you need to do in, say, Oklahoma City or Cleveland, Ohio, or San Francisco, California. Instead, what we're doing is we're creating the right environment to create the right incentives. So we talked about obstetrical care. We are also exploring the other outcomes in opioid overdose, in cardiovascular prevention, and in alcohol-related health harms, because those are kind of the four horsemen of our healthcare disparities more broadly. So what we'll do, what's very exciting is we're actually going to measure those outcomes almost in near real time. And then honestly, this is the exciting piece of it. We're going to rely on the ARPA-H innovators, we call them performers, to actually develop what works in that area. And if it works, they will be rewarded for it. So we're really looking for their creativity as well.
That's great. So the ARPA-H innovators, right? Are they locally based? Are they embedded in the community? And you talked about, people taking ownership of a geography.
Yes.
Who is the owner?
Yeah. So let me be clear. With ARPA-H, we're a funding organization and we give contracts out. So these are not sort of federal employees, but we're going to be doing an open, broad announcement asking for people to sort of send their application. That's our model. So we really sort of see ourselves as seeding the innovation pools all around the country. Now, as that sort of comes together for this particular program, we want to be broad. Like, for example, not all prevention is delivered by subspecialists in hospitals. So we've kept it very broad. It could be nonprofit organizations. It could be a provider organization. It could be an early startup company. It could be sort of a consortia of all of those that sort of pool their resources together. That's actually what we'd like to see, is if they collaborate and they're all kind of aligned on this one thing they want to do, whether it's we're going to reduce the rate of opioid overdose or maternal complications, that's sort of where we think will also, that relentless focus on that outcome, we think that's going to be important.
So you talked a little bit about the timeline for the announcement, right? So when you do this announcement, is that when the rollout will begin of this program?
Yeah. So when we announce this program, what we'd like to do is we want to first make sure that we're hearing from the community. Like, we haven't figured everything out perfectly. So likely what we would do is to do like what we call a draft solicitation. So that would show, hey, here's all our thinking, like open it up, kind of look at everything, and then give us your feedback. And then we'll take that feedback, and we work very quickly at ARPA-H, and we'll turn that around and then post the full proposal to which people can apply probably in very short order. Within the same quarter is what we would try to shoot for.
That's great. I mean, that sounds wonderful. And good luck, Darshak, with rolling out this program, the HEROES program. It's a proposed new program from ARPA-H, and it sounds really exciting and filled with results and outcomes using technology and the latest innovations. So thank you for joining us. It's been a pleasure talking to you, and it's been a pleasure to show you around Cure.
Thank you so much. Looking forward to next time.
Great.